Do you have a partner? Do you have kids? Do you have grandkids? Do any of those apply to you, Kev?
Partner, yes. Everything else, I don't think so.
If I said to you, you could never hear or understand Jess again, what would you say to me?
I'd be very sad.
Is that loss worth, you saying like, I would rather just not wear the hearing aids?
Right.
Like,
also, credit me for not giving the joke answer, which would have been, yeah, I can go without hearing my girlfriend. Credit me for not saying that. Credit me for giving the real answer, which was, I would be very sad.
I give you props for that.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now here are your hosts, Dr. Ali Tressiter and Kevin Ziener.
As always, I'm Kevin Ziener.
I'm Dr. Ali Tressiter.
Today, Dr. Ali and myself, we will be discussing a question proposed by Dr. Joan McCormick, formerly of Atlantic Hearing Care, in which she asks, does your hearing get worse if you don't wear your hearing aids? Now, that might sound obvious, and the answer might be obvious, but that's not going to stop us from asking the question, answering the question, expanding upon the question, and then clearly talking about things that have nothing to do with the question.
Yes, we're going to unpack it and then just spice it up with our beautiful faces and our comedy.
We're going to unpack it, look at it, wear it, repack it, put it away, grab out a completely different article of clothing.
Yes.
And then talk about that.
Yes.
Love it. So, Dr. Ali.
Yes.
If you do not wear your hearing aid, does your hearing actually get worse?
No.
Oh.
So your actual hearing, meaning your thresholds, when you go in for a hearing test and you listen for beeps and you press a button when you hear a beep, if you do not wear your hearing aids, that is not going to get any worse. However, if you have a hearing loss and you do not wear your hearing aids, what is going to suffer is your speech intelligibility, so your ability to understand speech, especially in complex environments.
Okay.
And so what hearing aids do is they will stimulate your auditory cortex. And when you take that away and you are not stimulating the auditory cortex in all of its areas, you're actually losing gray matter. The brain actually loses gray matter if it's not stimulated. And so you are running that risk of damaging things, in the brain versus maybe can you press a button when you hear a beep?
Sure. If I'm not, because we've talked about this before on the podcast, in order to get accustomed to your hearing aids, you just got to do it, right?
Yep.
You have to wear them. You don't want to wear them in wet or humid or moist situations, but morning to night, you want to have those bad boys in.
Right.
I think maybe the question would be better posed, like if I start wearing my hearing aids and then for whatever reason stop wearing them, is that then going to deteriorate my hearing? Is there anything related to simply not wearing the hearing device that is then going to have a negative effect?
Again, like on the actual, like if you've been wearing it and then you just stop wearing it, or you only wear it sometimes, it has less to do with your peripheral hearing than it has to do with everything happening in the brain. Because what I want everyone to understand is that hearing does not happen in the ear. It happens in the brain.
Got it.
Everything important happens in the brain, especially understanding speech, right? And so if you are not wearing your hearing aids all the time, or you just like quit cold turkey for whatever reason, the same kind of rules that I described apply is you are allowing those connections in your brain to atrophy. You are not providing stimulation to the auditory cortex in a way that you should to maximize your ability to understand speech. So we had mentioned before, when you're first fit with hearing aids, how you hear and understand speech day one is not nearly as well as you're going to hear and understand speech day 60, day 180, because your brain has had time to make those connections and make sense of this signal. But it can only do that with constant stimuli. And so if you take that away or you're intermittent, it's really impossible for your brain to make those connections and keep those connections. So you're doing yourself a disservice by not wearing them.
So what if I try to poke holes and I say, hey, I don't necessarily want to wear my hearing aids anymore because I'm actively engaging my mind by trying to read people's lips as they speak to me. I just don't like the hearing aids. They don't feel comfortable. I don't like the way they look. But when I'm in a conversation, I'm locked in, looking at the lips, reading the person's facial expressions. Is that a way to make up for it?
Well, two things. One, that is providing zero stimulation to your auditory cortex. So if you're saying like, listen, I never want to hear again, I mean, I guess I'm not going to fight you on that, but I would then pose the question, do you have a partner? Do you have kids? Do you have grandkids? Do any of those apply to you, Kev?
Do I have a partner? Do I have kids? Do I have grandkids? Partner, yes. Everything else, I don't think so.
If I asked you, and Jess, if you listen to this podcast, you better keep an eye on this answer. If I said to you, you could never hear or understand Jess again, ever, what would you say to me?
I'd be very sad.
Yeah. And that is really what I want to tap into, is that when you are not stimulating your auditory cortex, you're doing yourself such a disservice, because like, you can't hear the birds chirp. You can't hear your grandkids. You can't hear your spouse. You can't hear the people in your life that really bring meaning to your life, right? And that's a huge loss, And is that loss worth, you saying like, I would rather just not wear the hearing aids?
Right.
Like, you know what I mean?
Also, credit me for not giving the joke answer, which would have been, yeah, I can go without hearing my girlfriend. Credit me for not saying that. Credit me for giving the real answer, which was, I would be very sad. I would be very devastated.
I give you props for that.
Thank
I'm
you.
sure Jess will be very happy.
More often than not, I lean into the joke, but not this time. I didn't. I did not lean into it.
I will say, because audiologists, we always like to joke that we're also like marriage counselors, because a lot of times we'll see partners together, because inevitably one partner says, my hearing loss isn't so bad. She just mumbles, or he just mumbles. And then the other partner says like, no, I'm talking normally. Like he just can't hear, or she just can't hear everything. Right. And so it's funny. I've heard that joke many times of like, I just can't hear what they're saying. Or like, it'd be okay never hearing them. Or does the wife have a mute? Like, does the hearing aid have a wife mute button? And like, ha ha ha.
You're like, let me write you a referral for your clear marital issues.
Yes, we're going to put that in the parking lot, because like that, we need to unpack that with a therapist. But also like, they're jokes, but I always feel like it's them deflecting like how much it really affects them, right?
I do find it really interesting. And again, there's stigmas on it for 1,000 different reasons for a ton of different generations as well, right? You clearly don't care. I clearly don't care. But what I do find interesting is, like, if not wearing the hearing aids doesn't make your hearing get worse, right? So then the question would be, so then what makes it get worse? Or is it in suspended animation until it gets traumatized again?
Right. So good question. So to answer that, I want to make sure that everybody keeps in mind that when you're talking about hearing, we're talking about peripheral hearing. Can you just sense that there's a sound, not understanding? Because understanding will decrease without the hearing aids, right? And so just peripheral hearing loss, I mean, as you age, hearing loss is normal and natural. But exposure to sound, even when you were young, we see a lot of veterans that were exposed to a lot of loud noise, even in Vietnam or in these different wars, but it didn't present until later. And when it presents, it's quick.
Wow.
And so it can be all sorts of things, but hearing loss is cumulative and, happens over time. And so it could be damage from before, it could just be aging. They could be exposed to a new loud sound. It could just be, medications. Yeah. It could be, especially medications used to treat cancers, those sorts of things.
So in your professional opinion, your doctoral opinion, what are the best things that somebody can do who has hearing loss?
Wear hearing aids. All day, every day. Yeah. I mean, truly, that's the very best thing that you can do is first treat the hearing loss with hearing aids, give your brain that constant stimulation, right? But then also practice really good communication strategies, because just because you put hearing aids on doesn't mean that when I go over here into the kitchen, if I'm talking to you, you're going to be able to understand, right? Yeah. You still have to look at each other, right? There's a lot communicated in hand expressions or face expressions. And so communication strategies are really important. So I say that to say, you'll never be able to really talk to your partner from another room and expect them to hear. My husband and I have perfect hearing, both of us, and we still make the mistake of talking to each other in different rooms, and neither one of us can understand.
Sure, screaming at each other.
We never scream at each other.
No, I mean like screaming at each other because you're in different rooms.
Yes.
Not screaming at each other because you have marital issues.
No, we definitely do not.
Yeah. To be clear, other people outside of Dr. Allie and her husband have problems. Not.
We are very happy.
Yeah, no. We are happy. We love each other very much.
Yes. The louder I say it and the more aggressive I am, the more everyone's going to.
Everybody knows that. When you scream your love for somebody, that means you have the most love for them, and you don't have hearing loss.
Yes.
Which is important.
Exactly.
So now that everybody knows the importance of wearing their hearing aids and being in a healthy, functional relationship, make sure that you go to Ask an Audiologist for all your audiology questions. We don't really have any marital questions or answers on the website.
No, but they can write in. Yeah. Like, listen, if they want to go like Dr. Allie and Kev.
No, just Dr. Allie. I don't want any part of this. I not married and do not want to be held remotely responsible for breaking up any marriages.
Well, you can just add the humor as I give horrific marital advice.
You give the actual instructions, and then I'll just I'll subtweet everything that you say.
Excellent.
Thanks, Dr. Allie.
Thanks, Kev.
We'll see you guys next week.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.